Welcome to 100-Year Health, a channel dedicated to understanding the human body, healthy living, and the science behind everyday health questions. Have you ever stood up quickly from your bed or chair and suddenly felt dizzy for a few seconds? Maybe the room seemed to spin slightly. Your vision may have dimmed or gone blurry for a moment. Sometimes you might even feel like you need to grab onto something to steady yourself. Then, just as quickly as it started, the feeling disappears. Within a few seconds, everything feels normal again, and you continue with your day. This brief sensation is extremely common. Many people experience it occasionally, especially when standing up quickly after sitting or lying down for a while. But why does it happen? To understand this, we need to look at how the body controls blood flow and blood pressure. Your brain is one of the most important organs in your body, and it requires a constant supply of oxygen and nutrients delivered through the bloodstream. Even a small interruption in this supply can cause noticeable effects, including dizziness or lightheadedness. When you are lying down or sitting, your blood is distributed relatively evenly throughout your body. Your heart pumps blood upward to your brain and downward to the rest of your body with relatively little resistance. However, when you suddenly stand up, gravity immediately begins to influence how blood moves inside your body. As you rise to a standing position, gravity pulls a portion of your blood toward the lower part of your body, especially your legs and lower abdomen. For a brief moment, this shift can reduce the amount of blood returning to your heart. When less blood reaches the heart, the amount pumped toward the brain can temporarily decrease. Your brain is very sensitive to even small changes in blood flow. When the brain receives slightly less oxygen-rich blood for a short time, it may produce the sensation of dizziness, lightheadedness, or brief visual changes. But your body is designed to correct this problem almost instantly. Inside your blood vessels are special pressure sensors called baroreceptors. These sensors are located in major arteries, particularly near the heart and neck. Their job is to constantly monitor blood pressure and send signals to the brain whenever a change occurs. The moment you stand up and blood pressure begins to drop slightly, these sensors detect the change and immediately alert the nervous system. Your brain then responds by adjusting your heart rate and tightening certain blood vessels. These rapid adjustments help push blood back toward the brain and restore normal circulation. Most of the time, this entire process happens within just a few seconds. Once the body detects this sudden change in blood pressure, the nervous system immediately begins working to correct it. The brain sends signals through the autonomic nervous system, which controls many automatic functions in the body such as heart rate, breathing, and blood vessel activity. These adjustments happen without you needing to think about them. One of the first responses is an increase in heart rate. Your heart may begin beating slightly faster in order to pump more blood through the body. At the same time, certain blood vessels begin to tighten or constrict. This process helps push blood upward against gravity and back toward the brain. These changes help restore normal blood pressure and circulation within just a few moments. For most people, this entire process happens so quickly that the dizziness lasts only a few seconds. However, the sensation can sometimes feel stronger depending on a few everyday factors. One common factor is dehydration. Your blood volume depends partly on how much fluid your body has available. When you are dehydrated, there is slightly less fluid circulating through the bloodstream. This can make it more difficult for the body to maintain stable blood pressure when changing positions. As a result, dizziness when standing up may feel more noticeable. Another factor is fatigue or lack of sleep. When the body is tired, the nervous system may respond slightly more slowly to sudden changes in posture. This delay can make the temporary drop in blood pressure last a little longer than usual. Low blood sugar can also contribute to feelings of lightheadedness. The brain relies on a steady supply of glucose for energy. If blood sugar levels are low, the brain may become more sensitive to small changes in blood flow or oxygen levels. This can increase the chance of feeling dizzy when standing up quickly. In some cases, standing rapidly can angus. If you move suddenly from lying down to standing without giving your body a moment to adjust, gravity pulls blood toward the lower body more quickly. This can briefly overwhelm the body's automatic balancing systems. That is why many people notice less dizziness when they rise more slowly from bed or from a seated position. Although occasional dizziness when standing is usually harmless, it is a reminder of how precisely the body regulates circulation. Every time you change posture, your cardiovascular system and nervous system must work together instantly to maintain balance. Blood flow and oxygen delivery to the brain. Although occasional dizziness when standing up is very common, there are certain everyday habits that can influence how often it happens. One of the most important factors is hydration. Your circulatory system depends on an adequate amount of fluid to maintain stable blood pressure. When the body becomes dehydrated, blood volume can decrease slightly. This makes it harder for the heart and blood vessels to quickly adjust when you change positions. As a result, the temporary drop in blood pressure may feel more noticeable when standing up. Another factor is how quickly you move. If you rise suddenly from a lying or seated position, gravity can pull blood toward the lower part of the body very quickly. Your cardiovascular system can still correct the imbalance, but the rapid shift may briefly reduce blood flow to the brain before the body fully compensates. Standing up more gradually can sometimes give your body enough time to adjust. Physical conditioning may also play a role. Regular physical activity supports healthy circulation and helps maintain the responsiveness of the cardiovascular system. When the heart and blood vessels function efficiently, the body can respond more quickly to changes in posture. Sleep patterns and overall fatigue can influence this process as well. When the body is tired or under stress, the nervous system may not respond as efficiently to sudden changes in blood pressure. This can make lightheadedness feel slightly stronger or last a little longer. For many people, simple lifestyle habits such as staying hydrated, standing up more slowly, and maintaining healthy daily routines can help support the body's natural balance mechanisms. At the same time, it is important to remember that the human body constantly communicates through small signals. Sensations like dizziness, tingling, fatigue, or changes in balance are often part of the body's way of maintaining stability and adapting to movement. These signals reflect the complex coordination between the brain, heart, blood vessels, and nervous system. By paying attention to how your body responds to everyday situations. You can gain a deeper understanding of how these systems work together to keep you functioning normally throughout the day. Thank you for watching. If you enjoy learning about the human body and the science behind everyday health questions, make sure to follow the channel for more videos like this. And if you found this video helpful, don't forget to like the video and share it with someone who might find it useful too. Stay healthy, take care of your body, and see you in the next video. This video is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional for medical concerns.